It's about reducing barriers, honestly, between patients and physicians. I think everyone could probably agree that healthcare feels very fragmented, especially with patients. They're often caught between appointments, referrals, administrative steps. With Riverside Medical Clinic, we're intentionally working to reduce those barriers by sort of strengthening the connection between the patients and their physicians in person and digitally through the patient portal, as an example.
This is the Faces of Riverside 2026 magazine podcast series. In addition to folks being featured in the annual magazine itself, we like to sit down with them individually and talk about their organizations, their own experiences and backgrounds, and learn a little bit more about what they're doing and their good works as a whole. Today, we're joined by Mark Queenan, the CEO of RMC's Patient Services. And Mark, it's great to have you. I appreciate you coming on.
No, it's my pleasure. My pleasure, Norm. Yeah. Well, I could maybe give you a short introduction here if that would work for you.
That would be awesome.
Yeah, sure. Well, I've been in healthcare for a little over 20 years, sort of on the hospital or health systems side of things. So originally from Atlanta, Georgia, but spent a lot of my career with Cleveland Clinic in Southeast Florida, around 10 years there, overseeing a large hospital physician network. Most recently moved out to California in 2018 to start a management service organization in Orange County. Prior to joining RMC, I was the national or corporate vice president of medical groups for Prime Healthcare out of Ontario, California. So I've been with Riverside Medical Clinic for about 6, almost 7 months now.
So still relatively new, getting your feet underneath you.
Yeah, still relatively new. Yep.
Okay. Okay.
Off to a good start.
Oh, well, that's fabulous. So with that extensive background that you
Right.
have, why RMC?
Yeah. So I think sort of going back to what I was doing with Cleveland Clinic in Southeast Florida, where I was over just one large physician network, as opposed to um, trying to manage physician networks in various states or associated with various hospitals. So this is sort of one collective group of physicians, and I feel like this is something I enjoy more. It's certainly more in my wheelhouse, where I can be involved in, the financials, the day-to-day operations. I get to interact with the physicians, on a regular basis, one-on-one meetings with managers and, interact with patients. So just the ability to have more of a presence with this group, rounding on the clinics and things like that. So, yeah, I think maybe just, being able to impact what's going on in an organization on a day-to-day basis rather than sort of thinking nationally is what attracted me to this role.
Okay. So my understanding is that the physicians themselves have ownership
That's right.
within the organization as a whole.
Right.
Is that unique to general or typical healthcare providers?
It is unique to California. So California is one of the states where it's called the corporate practice of medicine guidelines. So where physicians have to maintain control and ownership over their professional corporation, but then they can have another other entity that's not physician owned manage that entity from an operational perspective. So that's the arrangement we have here. So my role is with Riverside Medical Clinic Patient Services, and so we manage all the day-to-day operations, the employees, the buildings, the infrastructure, the medical supplies, all those things, so the physicians can simply concentrate on just seeing patients and providing great clinical care.
Okay, so you may have actually just answered what I was thinking in terms of my next question. Is there a benefit on the patient level? I completely understand the benefit for the doctors to have a separate organization, manage the day to day, the typical functions that go on in a medical clinic such as yours. Is
Right.
there a benefit that extends or that's visible, if you will, to
Mhm.
patients?
I think so. I think because our our ability to focus strictly on the operational side of things. We can introduce and sort of roll out better technologies for patients to interact with their providers. We can be a little bit more directionally correct on opening up access points for the physicians, scheduling, things like that. So I think it does allow us to get really sort of focused or granular on the operation side, and find a lot of economy of scale and hopefully reduce barriers for patients in the long run and free up more time so they can interact with the providers.
Okay. Well, I know that RMC Riverside Medical Clinic has a pretty extensive past history here in Riverside.
Sure.
I think it's been 90 years
Right.
that the organization's been in existence.
Right.
Obviously, to have that kind of longevity and the kind of success that you've had in terms of growing implies that there is quality health
Mhm.
being provided, healthcare being provided to patients. What if you could define in your own words, what does quality health really look like? Quality health care.
Right. I think it's about reducing barriers, honestly, between patients and physicians. I mean, I think everyone could probably agree that healthcare feels very fragmented, especially with patients. They're often caught between appointments, referrals, administrative steps, those type of things. So with Riverside Medical Clinic, I mean, we're intentionally working to reduce those barriers by sort of strengthening the connection between the patients and their physicians in person and digitally through the patient portal, as an example. I think reducing barriers is certainly one of those, and I know access is one of the most important things that's facing Riverside County, and I mean really most places around the country. So. I think RMC does a good job of expanding appointment availability, creating more opportunities for patients to self-schedule, those type of things. So expanding access points and reducing barriers, I think is what RMC sort of excels at.
Okay, so I want to dig a little deeper on that if I can,
Sure.
but just in terms of some basic information, in terms of the scope of the clinic,
Right.
you have multiple locations. That's correct.
We do. Yeah. We have three what we would call large like health plexes or medical office buildings. And so we have the main campus here in Riverside, which also has a surgery center. And then we have another large medical office building in Moreno Valley off of Day Street. And then we also have another large one in Temescal Valley in Corona. So those are our three sort of large footprints where we have 40 to 50 providers in each of those locations and surgery centers as well, full imaging modalities in addition to the surgery centers. And then we have four smaller satellite locations. We have one in Eastvale, Yoruba. We just opened a new clinic location in Marietta. And we have another small location that's has some adjacency to the Moreno Valley Medical Office building. So we have seven total locations, and just a little over 200 physicians and mid-level providers, mostly physicians.
So looking at the three larger locations, or I'll just call them the primary locations for the sake of this conversation, do they mirror each other in terms of the available services? One does not have to visit one and then visit another for something else?
Yeah, and that's the whole idea, right? Is sort of we've sort of triangulated these locations, but yes, I mean we have a lot of primary care depth at each of those locations, and then we have all of our specialists and subspecialists there from cardiology, orthopedics, gastroenterology, medical subspecialties such as rheumatology, endocrinology. And yeah, we have those same specialties at each location, and we have some physicians that'll spend 2 days at, for instance, in the Riverside, the main location, and then 2 days in Temescal, that the Corona location. So, but I think we have all our bases covered in terms of the uh, the specialty coverage.
Does there does it make sense then? I understand that, for example, a specialist in Riverside will spend a few days there and then a few days in Temescal Canyon.
Sure.
Is that an issue of capacity? Is there room in the brick and mortar to eventually have enough specialists, if that's even the right way of framing this?
Yeah.
Or does their model work better the way that it is now?
No, I mean, I think you bring up an interesting point. So the way we typically structure the physician clinic or office hours is if we're if we're recruiting for a new specialty at one of those locations, for instance, if we need to add another cardiologist there, we may have one of our existing cardiologists at the main location, for instance, we'll cover 2 days a week there. But once we recruit, another cardiologist to Temescal Valley, for an example, then that cardiologist would sort of move back to their more regular practice in Riverside. So there's a little bit of back and forth with managing physician schedules. The goal is always to have physicians that have a home base, and whether that's at the main location, the Merino Valley, or the Temescal. So there's always going to be a little bit of cross coverage with some of the physician specialties, but for the most part, our goal is always to have a permanent footprint with physicians that are sort of anchored at those locations.
So does the responsibility for the ongoing responsibility, I would imagine, for recruiting, does that fall on your side of the equation or on the physician side of the equation?
Yeah, the recruitment is definitely a team effort. So from our end, we do have a full-time physician recruiter here, and that individual sort of reports to the patient services side, my side of things. But also, obviously, we couldn't recruit these physicians without the RMC physicians being involved. And of course, ultimately, they're employed by the Riverside Medical Clinic physicians from with their corporations. So it's absolutely a team effort on both sides.
Okay. Okay, so if I can, Mark, I want to circle back to the access
Sure.
that you talked about.
Right.
That is obviously what I would imagine, especially in your industry,
Hmm.
is a critical piece
Hmm.
to overall satisfaction of a
Hmm.
patient in terms of their healthcare experience.
Hmm.
You mentioned some technology, and
Sure.
we all are accustomed now more and more to taking advantage of technology to have food magically appear at our front doors, and applications and loans and things done online. So my assumption is, and I guess, or my question is, so as a potential or as a patient of RMC, I have access to the ability to make appointments, to look at lab work results. My records are all there. Is all of that kind of self-contained?
It is, yeah. That's self-contained in our patient portal, which is called My Healthy Connection. But yeah, it allows patients to book care on their own time without phone calls or delays. And it's definitely improving the scheduling, the communication, and the sort of the follow up between the clinics and the patients. It definitely makes it easier for patients to get timely care while reducing sort of the frustrations that everyone goes through with unnecessary wait times and things like that. So, but we are expanding access with our patient portal. So we are allowing patients more access to self schedule on their own, to update their sort of health maintenance areas on their own, such as reporting their blood pressure, and things like that, adding any sort of outside testing or something like that that wouldn't be necessarily done or wasn't done with RMC. So it definitely does open up a lot more, or reduce a lot more barriers for patients. But we are looking to sort of to reboot on our patient portal because there's a lot more that we can do. And so we are going to be revamping or rebooting our patient portal in the next probably 90 days. So for our patients, it should look better to them, and it should feel better to them in terms of more access points to our clinics and to our physicians.
Okay, so that being said, there's always typically the other side of the two-sided coin, right? Is there, as you're developing this or these enhancements and expanding the access, do you have to take into account the humanization of the interaction as well? Do you worry that it becomes too digital, if that's even a possibility? And is that a thought that you work with or struggle with?
It is. I mean, technology should, I mean, at the end of the day, it should enhance patient care. It shouldn't complicate it. So, and that's part of our strategy to shift to more of a patient self-service culture where patients have more options with scheduling, with access to our specialists, and to, sort of more real-time messaging with our clinical support teams that work with the physicians. So, I mean, those tools are sort of, they're not meant to really replace personal interaction, but they're there to sort of to remove the administrative barrier so that when patients and physicians connect either digitally or in person, the interaction feels more focused and a lot more efficient. So we're hoping the technology and the changes we're going to make are going to enhance or sort of break down those barriers and not create more barriers for patients. And I'm pretty confident that's going to be the case.
Excellent. So, Mark, I have to say, in all honesty, one of my personal pet peeves is that using technology to make appointments, for example, and I show up on time for my appointments and I wait, and I am not a member at RMC yet, but it seems like the personal interaction with the actual physicians themselves, that time feels very squeezed today. Assume there are a lot of commonsensical, logical reasons for that.
Right.
But losing that ability, or having that ability to sit and chat with a doctor, and be able to ask all the questions that I have and so forth, seems to be a growing concern. Is that something that you guys have to deal with as well?
It absolutely is, and I think it's something that health systems will always struggle with. It'll be a balancing act. There's certainly a lot. There's a lot of things that we can do to create more of that face to face time between the patients and our physicians. So one of it is to allow patients to check in online and to sort of reduce those barriers, so where they can immediately come into our clinics and they can begin the exam or the meeting with our providers there. So sort of reducing those front end or front office barriers is going to create more face to face time between the physicians and the patients. So that's something that we're very focused on right now. So, and we think that's going to have a meaningful impact on the provider and patient relationships. Rely on patient feedback as well. So, we listen through surveys, online reviews, direct conversations, and sort of the input that I get from our frontline staff. So that feedback helps us identify friction points and opportunities to improve, and it also allows patients to know that their voice is being heard and that we're able to sort of directly influence how care is delivered at RMC. So that's definitely important to us as well.
There's two other components that I imagine could be part of the access topic that we're kind of talking about at this
Mhm.
moment.
Right.
One being insurance and the other being billing. Are those all connected as well within that type of access, that portal, or are those separate systems?
Right.
I come in with insurance A, but maybe my insurance changes. Are those things that I can interact via the web, or do I need to have, direct conversation?
No, that's something that the patients can definitely affect on their own. So, patients can definitely go into their patient portal account, and they can add and remove their most updated insurance information. They can make payments online. They can prepay their copay before they come in for their clinic visit. So there's a lot that patients are able to do from a insurance and billing perspective. So, and we certainly understand these processes can be complex, but we're certainly trying to make that more transparent and understandable for patients. So we are focused on one of our initiatives is clearer communication around coverage costs and patient responsibility, and on supporting patients with questions when they arise. We're looking at currently we have a centralized scheduling component here as well, but we also that same centralized scheduling department also is able to answer questions from patients on their insurance and billing and things like that. So they are going to get a live person when they call RMC if they have questions with their insurance or billing.
Okay, great. Thanks for that. In terms of I guess part of the responsibility that comes with being a long-term healthcare provider in this community like Riverside is engagement within that community.
Mhm.
And I'm wondering if you can talk to some of the efforts that RMC makes to support, to engage, to be a community neighbor.
Mhm. Yeah, I mean, we serve a really large and diverse patient population here in Riverside County. So it's essential that the patients still feel a personal connection to their care. So we prioritize local leadership, um, strong clinical teams that are responsive to our patients, and sort of consistent service standards, so patients experience continuity and familiarity with the RMC. I mean, we are continuing to grow RMC and to add more access points, to add more providers, but the growth should never come at the expense of the care that we're providing to patients. So we do realize we're a big part of this community. I mean, we take pride in that, and we wear that as a badge of honors. So we do look to provide extremely high clinical and customer service standards to our patients. And I think you'll see those standards increase even more over the next several years.
Okay. If I'm not mistaken, you also do, I believe I've seen like health fairs or things that take place outside of the brick and mortar of the Riverside location, at least. Are those things that you engage in as well?
We do. We have several annual health fairs. We offer CPR courses here at RMC main location. We have partnerships with some of the local high schools for sports medicine as well. We do annual flu clinics to open up access points for patients on the weekends. So we also operate 3 urgent care centers, and those are open from 8 a.m. to 8 p.m. And so we do have expanded access points for patients as well, but in addition to what we're sort of our community service offerings.
Okay. Okay. So a little bit, if I can focus just back on you for a second.
Sure.
You've been on board now for more than half a year, or just about half a year. I assume, have begun to fully encircle your arms around the opportunities and the challenges and things that are offered in the critical role that you play. That being said, you got to wake up every day,
Right.
and when you do so, what's your motivation? What is it that drives you in this role in
Right.
particular that excites you?
I think with this role in particular, I think Riverside Medical Clinic has has the potential to sort of take their market positioning and the sort of the clinical standards to a higher level in the community. So I think RMC could could position itself, is a more larger or a large player in Riverside County, um, and open up more access points for patients. I think there's a lot of sort of untapped potential still remaining with RMC. It's a great physician model. There's physicians that have been with this group for 20, 30 years. There's new physicians joining all the time. So I think that the culture here is excellent, but I think certainly there's always areas to improve. And I see this. What gets me excited about this group is just the potential to expand services to patients, to provide better care to patients, opening up different access points, those type of things. So I guess breaking down barriers for patients is sort of what gets me out of bed in the morning. And I think RMC is well positioned to well, they're doing that now, but I think we can do a much better job in the future.
So does expansion include brick and mortar potentially as well?
It does. It does in some areas. So right now, I would say about 90% of our patients are in the North Riverside area. So we did open up a clinic in Marietta in August of last year. So I do see a lot of growth opportunity for RMC in South County, but there's also a lot of opportunity for us to add, more physicians and probably a few additional locations in North Riverside County as well. So I think we'll see growth in both North and South over the next 3 to 5 years for sure.
Okay. Okay. Well, you obviously have, with a 90-year track record, you obviously have an incredibly strong foundation from which to grow and expand. I'm just wondering at this point, and I appreciate you spending some time with me and ultimately with the audience talking about the good works that RMC does. But is there something I didn't ask? Was there a question I didn't ask that I should have?
No, I think one of the things that sort of seems to be top of mind also is physician burnout or provider burnout. That seems to be a headline that you see fairly often. So, um, we are acutely aware of that. We the physicians and staff at RMC, they're at the heart of the patient experience for us. So we're working to reduce the administrative burden, by streamlining workflows, investing in support systems that allow the clinicians to practice at the top of their license. So we are focused on the physician and staff experience as well, and obviously the retention part of that, because we think long term that's in the best interest of our employees and best interest of patients as well.
So if I could follow up on that, the physician burnout is, it sounded like what you said is that a lot of that comes from the administrative side of the equation for them as opposed to necessarily patient care. Am I interpreting that correctly?
You are. I think um, that's one of the issues that's at the sort of the forefront of physician burnout is that, the amount of time they have to spend in the electronic medical record system. I mean, we're intentionally trying to build some care teams where physicians and nurse practitioners work in close collaboration, and we're aligning providers around shared expectations and clinical standards, and trying to shift their focus to the face-to-face patient encounter as opposed to more of the back office work that a lot of times they're sort of engaged in. So just having them operate at the top of their license, I think, is what they enjoy, and I think obviously that's the standard that we want to achieve here.
Well, that sounds like a really important goal.
Yeah, it
And it
is.
sounds, yeah, and it sounds like you're, trying to take the steps to mitigate that, because I know that in addition to the administrative stuff, um, or challenges, if you will, I know that the ratio of doctors to citizens, in the city and in the county, is not ideal. So I imagine there's lots of reasons to be overwhelmed, but just kind of hearing that your focus, or one of your focuses, is improving the quality of their day to day life, if you will, functioning professionally as a physician is super important. So I appreciate you sharing that.
Sure.
Okay, so Mark, I appreciate you coming on and
Absolutely.
talking with us a bit. I'm going to include in the description of the video the website and basic contact information because folks, as they as they continue to learn about the amazing work that RMC is doing, need to have an entry point.
Yeah.
So I'll do my part to provide that information to them. And again, thank you so much for joining us.
Thank you, Norm. I appreciate it.